How do you see virtual reality integrated into your practice? Do you use this kind of technology for surgical training? Like there are systems right now in the orthopedic space to, because the workflow and the instrumentation may be complex, so surgeon can train ahead of the procedure to make sure that they understand all the steps and take the right instrument at the right time. How does virtual reality could be applied to your space?
Right, so it's a good point, and it's a little bit different from specialty to specialty. I understand in orthopedics, you have a lot of instruments, a lot of
Yeah,
different screws, different patient anatomy, different implants. In general surgery, it's not so much the case. I mean, there's a little bit of virtual reality training in terms of like the Da Vinci modules, where you can train on, the steps of a gallbladder, steps of an inguinal hernia, things like that. But that is more at the very basic level, right? We're not there yet where virtual reality provides you a very accurate representation of the actual patient. It's just
okay.
not there. But things like what Inovus is doing with kind of the hybrid model, right? They have the physical model
Yeah,
to give you the fidelity of a real structure. Then they have the augmented reality overlay. Then they have the software analysis, right? I mean, to me, that's the best case scenario where you have easy to access physical model that you can ship out, and then you have all of the fancy stuff on the back end through software,
hmm,
because it's easy to scale that, and this Proxima is similar to that, where they have kind of the easy to access devices they send out, but then the genius of the platform is really on the back end, on the software side.
yeah. So it comes back to
um,
the digital data platform. I understand
right.
like the Inovus system yes, they have a surgical simulator with the physical models. They have a virtual software, but they also have this data platform that enables to capture what happened during the virtual case and then analyze what happened and what need to be improved and give insight back to the surgeon. Yes, so I understand that. That's very insightful.
Exactly. And then
All
you
right.
can take that same technology and apply it to the actual case, and
Mhm.
kind of see, like the improvement in the actual case, some of the same analytics and things like that. So I think that's the most elegant solution type that I've seen is the low fidelity actual thing, or the easy to get actual thing with the really advanced software backend.
Okay.